Guys, so I am going to share with you my presentation on 9 months as a developmental milestone. Bear with me for a second. Okay. So the expected developmental milestones you should expect for a 9-month-old. So socially and emotionally, the child may start to cling to a parent or a caretaker. They may start to have that stranger danger sense of fear, but it shouldn't be absent or it shouldn't be intense. And they usually will have a favorite type of toy that they want to take with them wherever they go. For language and communication, the infant should express their needs by they're going to point out to something, or they're going to say, they're going to babble to us, and they're going to understand the word no or say the word no a lot. Infants at 9 months, they like to mimic movements and sounds as being a parent or the adult, people who they're around a lot. And then for food and nutrition, they should be at the point where they're starting to self-feed, and you can introduce a spoon, and they should be able to pick up the spoon and try to feed themselves with it. They also should be eating like a thicker period substance and staying fuller longer. For brain development, they love to go look for things that you've hidden. They'll play peekaboo. They'll watch something fall off a counter. They should be able to move an object from a right hand to the left hand and vice versa, back and forth. They will want to put everything in their mouth. That's how they explore. And an infant should be able to pick up an object using their index finger and their thumb. So like this. Strength and motor and coordination. The infant should be able to sit in the tripod position and sit up without assistance. They should also be using furniture to try to pull themselves on and should be crawling at this point. Okay, so screening tools. So basically, there are a lot of screening tools that are out there, but I really like the one that is produced by Bright Futures, which is also the little guide that we have for class. I liked this a lot because you can use it for ages like from 2 days old to 21, but it's it kind of goes over everything you need to know for a well child visit. So it focuses on the developmental milestones, the nutrition, and then safety, and also like the family unit's emotional well-being, which I think is super important for the child and for their health. I posted, like, this is the sample, but this is what one of the questionnaires are. So it's basically asking like the parent, what concerns are you bringing today? Because obviously the infant can't tell us anything yet. And then at the bottom, it basically asks the parent to check those milestones that we talked about. So if any of those boxes weren't checked off, then we can have a discussion about that and then evaluate the infant after that. So for the child development theory, I picked the social cognitive theory. So I found in an Iranian journal, a medical journal, that they did a case study on infants. They were ages 6 to 12 months. And they used this theory to prove that what parents were eating influenced the way that the child was eating by only using candidates who were failure to thrive kids. So basically, these infants were diagnosed with failure to thrive, and then they took how much weight they did or did not gain, and then how educated the parent was about what their babies should be eating to get that brain development and weight gain, and then how that basically affected their cognitive behavior to eat more or less. So basically, with using the social cognitive theory, the theory proves that an infant at 9 months will be more likely to follow what their parents eat, and directly influenced by this. So it's not as much what's just put in front of them, but it really is what their mom and dad are also eating with them, and the education that goes behind does that mom or dad know what a 9-month-old needs to eat? Okay, so anticipatory guidance. So as the future provider, when parents come into a well visit, we should be educating them about some parent-infant interactions that they should try to foster and encourage. So we want them to encourage their child with exploration of the environment by continuing with foreplay. So if that means getting on the floor and bringing some stuffed animals or that toy that they're really attached with, so that the infant can start to explore and try to stand up on the furniture. We want them to engage in conversation with their child while doing other activities. An example of this is like going to the grocery store and having the infant in the carriage with you and talking to the infant while you're picking up groceries. Movement and singing activities are really great for this age, like playing peekaboo or sing-alongs. Parents should read to their infants. You want to use, like before bedtime, you want to use like a big illustration book or something that has a lot of pictures. They also, so in order for a infant to learn how to self-cope, there's going to be this transition period. So this is a great time to start introducing this. So this is how kids become attached to something else other than their parents. So, you see older kids, still coming in with their blankie. So we want them to be attached or use some type of an item for coping other than mom and dad. So that could be a blanket, a stuffed animal. We really don't want them to use the pacifier, but something like an item wise. And then no bottles in the bed are allowed, and the restriction of the word no. So at this age, and even after that, kids will just say no for no reason because it's easy to say. And they know they don't necessarily know what no means, but starting to teach the 9-month-old what no actually means, and having a restriction of when it's used or not. Okay, and then lastly, developmental miles delays or red flags. So these are the majority of them, but if a parent becomes really concerned because the patient has been waking up overnight consistently and not self-soothing, if they don't sit up on their own or sit in a tripod position, that's a red flag. Upon exam, if they're negative for the lateral prop reflex, if patients are crawling asymmetrically, so they're using one side more than the other, if they do not initiate self-feeding, which we talked about, or they can't sit in the high chair, if they're concerned about their vision, and what goes along with that is that they don't reach out for objects, or they don't explore their surroundings by using their mouth or touch. They also don't respond back when we try to speak to them. They either have that extreme stranger danger or nothing at all. And then they don't respond to their name being called. So that was my presentation on 9-month-old, and I hope you enjoyed it. Thanks.